Okay, and let's start with the nursing, I guess. You said in your post that it was like kind of like a soul sucking career, right?
Yeah, yeah.
So why is that?
Well, you never had the resources that you need. You never had the help that you need. You were always overstaffed. I mean, understaffed, you had to do so many different jobs at one time. Like usually a nurse in a nursing home would have a med cart and you'd have either, um, one hall or one unit, and you would have CNAs that work with you. Sometimes, if you were lucky, you had a med tech. Um, but the way it was in reality, that's a perfect world. So in reality, you had a couple halls, maybe you had one CNA to help. So you would have anywhere from 20 to 40 patients on your shift. And a lot of times you worked 12 to 16-hour shifts. So, and this was before 2020. This is before the pandemic. It was really rough. And I was the charge nurse on an Alzheimer's unit for a few years. So I wasn't able, you're not able to leave your unit for breaks or anything. So it was really draining. And then I had went through a personal mental health breakdown. And after that, it just, you could not even, you couldn't do that kind of work. I tried to, and I just couldn't. But you always, even before that, you always feel like you never did enough for your patients. You couldn't give them the care that you needed or the care that they needed. Um, so it just was definitely soul sucking. Yeah.
Yeah, for sure. I don't know if that was like the exact word you used
It is
on the
because I've used
post.
it
Yeah,
before. So yeah, I've
yeah,
used it
yeah,
before. So yeah, I said that.
yeah. I
Completely
mean,
soul sucking. Yeah. All your time,
yeah,
all your energy, mind, body, and soul, all your energy. Took everything out of
yeah,
you.
yeah. I feel you because I mean, even at my job, I feel the same way.
Yeah.
I'm now I'm an Amazon delivery driver, but I've worked for the Amazon warehouse in the past, and it's like
Yeah.
sometimes you just feel like the stuff that they're asking you to do, like you just can't do,
Right.
or at least in the period of time that you're supposed to get it
Oh,
done in, or
yeah.
at least I can't. And so it's like this is impossible and also
Right.
unsafe, which is like now they're
Right.
like targeting, they're really going after, they're really trying to be as safe as possible. And I do honestly give Amazon credit for that. I think they kind of have to, being such a big company, but
Yeah.
I've worked with other companies too that are just don't seem to care about safety at all. So I mean, at
Mm,
least they're trying to care or pretending to care.
right.
Yeah, but so yeah, I was kind of wondering if you quit during the pandemic. I was kind of wondering what your thoughts were on the pandemic, because I know there's a lot of people out there who,
Yeah.
I don't really want to get, I don't know if you want to get too controversial, but there's a lot of people out there, even in the healthcare system, who
Yeah.
didn't want to get vaccinated or whatever else, and that was a big issue. I actually know my
Right.
sister was actually a physical therapist, and
Hmm.
she didn't want to get vaccinated. So
Yeah. Well,
even though you weren't in it, did you kind of know people who were in it, and how was
well,
that for
yeah,
them?
I know a ton of people in healthcare, of course. And there is definitely a divide. I'll just put it out there. I don't mind saying I'm fully vaccinated. I was all for it. Everybody in healthcare, we've had to get flu shots every year. So I didn't see this as anything different. I saw it as like, almost like a different version kind of what the flu would be. And it didn't seem like it was that big of a deal to me. But I also believe they didn't think that there was any kind of conspiracy as far as, all the, refrigeration trucks and all the extra, um, not having room for people in the ER and stuff like that. I believe that that was true. I don't subscribe to that being some sort of conspiracy theory. And I don't ever try to, I've probably never even said that out loud. I don't try to change anybody's mind or make anybody agree with me or think anything different than what they think. That's totally fine, but that's the way I felt about it. However, during the pandemic, I was in home health care, and there was a situation, I was in that I felt unsafe. And just not only the virus wise, but just otherwise too. And so I just was not at that point in my career, at the end of my career. So 2018, 19, 20, I was just not putting up with any more crap at all. Like, if I'm going to do this, it's got to be perfect. It's got to be good for me and not at all a toxic or unsafe situation. So I ended up quitting there. Actually, I didn't quit there. I did kind of quit there because I was in home health and it was a baby. We didn't have everything that we needed to take care of this baby's needs. They were trying to keep people out of the hospital as much as they could, but just to free up beds and rooms and stuff, and the staff. And so the patient in home health was at home and should have been in the hospital. And I knew it. And that was part of the reason I felt unsafe, because if something happens on my shift, it's going to be my problem. And I don't even have everything I need for this child. So that was part of it. But then when the child went into the hospital, they said to me, we'll keep you updated, blah, blah, blah. We'll try to get you another case until then. And I said, never mind. I didn't want to be in it anymore. And I was already taking classes for hypnotherapy, which I had started that in 2010, and continued nursing, and was never able to get that part off the ground, enough where I could quit nursing even in 2010. So, yeah.
Yeah. And I mean, I was like just talking with I don't know, I was just talking with my girlfriend about it, and it just seems like the whole healthcare industry in general just kind of sucks, because it's like I lost my job, and I have the same job now. I got a new job, and it's the same job, but it's with a different company through Amazon, because Amazon outsources their work essentially for the drivers. And so right now I don't even have healthcare. So if I was in a situation where, I had to go to the hospital or emergency room or whatever, I'm right now I'm pretty much just screwed, because it's like I'm just waiting to get the healthcare. If I want to pay for the healthcare, it's $500 a month, or I think that's what it is, right around
Crazy,
there.
yeah.
Which is nuts for somebody who's unemployed,
right?
And it's almost like these hospitals have kind of like somewhat of a monopoly, even though it's not a monopoly, because technically you can go to the other hospital. But it's like, if I'm sick, I have to go to the hospital,
right?
If I'm going to die, and they can just charge me $40,000 or whatever they want. And you can make a case that like that's reasonable, but what's not reasonable, in my opinion, is I go see a psychiatrist for like prescription medication, like antidepressants and stuff like that. And just to see the psychiatrist, it's $15, or no, sorry, it's $250 for 15 minutes, in which case
gosh.
it's a phone call that she asked me like 2 or 3 questions and doesn't seem to care. And that's it. And it's like, just to get this prescription antidepressant drug.
It's just the questions that they need on their record, on their forms, to be able to give you the medication. Yeah.
Which isn't much. It's like 3 questions maybe that she'll ask me, and then she'll be, okay, you're good to go for another 3 months or whatever.
Oh my goodness. Yeah.
Yeah. So,
and
I totally feel you there, but yeah.
Yeah. There was a lot within my whole career that they tried to do that was unethical, that was illegal. And I'm actually writing a second book all about my nursing career. So, just like the good, the bad, and the ugly, blood, sweat, and tears, not just from the patients, but yeah, there was a lot of people that were stealing the medications. Then there were patients that were, declining or getting worse and acting out and stuff because they didn't have their medications, because another nurse would, sign out that they gave them to them, but then they didn't really. It's just, there's a lot of corruption within it. And it's just really sad. It's really sad. Yeah. And I had tried to work in nursing homes. I worked in a small hospital for a short time. I worked in detox and recovery. I worked in then home health with all different ages and stuff. So I kept trying to go to different forms of nursing to keep my license and to keep, it's a good job. You can get a nursing job anywhere you want to live, right? And there's so many different types of jobs for nursing that I wanted to keep on, keep with my license, but I was trying to find a good fit and trying to find a place that was doing everything right. And I just had such a hard time finding that. But I also
Yeah.
had, I have arthritis bad in my hands now, which I didn't have before. And when you are in a nursing home, they have these medication cards. They're they're like cardboard with lines and rows of medications and pills that you have to push out with your thumb. And when you've got between 20 and 40 patients for between, anywhere from 12 to 16-hour shifts, you're doing that so much, you don't even realize it. And it causes, degeneration in your joints and your thumbs. So, just that alone, even, just really a soul sucking career for sure. Yeah.
Yeah. Yeah. Like I said before, I mean, I think there's a lot of soul sucking careers out there, and there's a lot of toxicity in the workplace, which like
Mhm.
should just not be there at all. It's kind of
Right.
like, I mean, there's I'm sure I'm not even a woman, but I'm sure there's tons of men who make women feel uncomfortable, like sexual harassment type stuff. That's why they have all the sexual harassment classes.
Yeah.
And I feel uncomfortable as a man, just being in certain environments. It's like, man, this is just horrible. Like,
Yeah.
and I just want to get out. And I think the goal is, like you were saying, to try and find, I guess, the perfect job for you, or not even job, but like the perfect specific job or location to
Right.
work at. But that's hard because you can't just be bouncing around from job to job. You know what
Which
I
I
mean? Like I
was
was
doing.
saying.
Yeah.
Yeah, because you're in the meantime, you don't have money, you don't have insurance. It's not fun. But I do talk, like I was talking just once again to my girlfriend today about it. It was her. So her friend is a nurse, and my sister is also a
Mm.
physical therapist.
Hmm.
And my mom was actually what do you call it? A psychiatric nurse. And I know
Oh.
that some people seem to really like the
Hmm.
healthcare industry. I don't think that I would. I think that I would be
Yeah.
on the same lines as you, where I would just feel uncomfortable.
Yeah.
But and my girlfriend's friend was telling her friend, it's kind of confusing, but like my girlfriend's friend was telling their friend, she basically she was saying how she only makes a certain amount of money and it's not enough, and she was just like, well, go get another job. And it's like, that sucks. Like, I don't want to have to work 80 hours a week just to survive, because that's how it is right now. You know what I mean?
Yeah.
It's like the company should just pay you enough money
Right.
so you can survive. That's all I'm asking to do, is just survive. But
Right.
in terms of it sounds like, my point with that was kind of like, it sounds like I know that she makes a good amount of money. So in
Hmm.
terms of the money is probably pretty good, right? As a nurse, or
Yeah. And that's why you want to try to keep with it. And that's why it's hard to change careers as a nurse, because first of all, you're working so much, you don't have time to look for another job, but also the money is pretty good, and you don't want to leave that. So you try hard to hang on to that. It is a good salary and you worked hard for it, whether you're a registered nurse or a licensed nurse, you worked hard to get to that position.